The aim of TCGA is really to try to change how cancer patients are treated. And everyone has that goal. Now, getting there is a very challenging problem. But I can give you some examples of how this really works in pediatric cancer, which is what we really work a lot on here at Nationwide Children's. And to give you an idea, we will get samples for kids that have been diagnosed with neuroblastoma. They might be diagnosed in Hawaii or California or even in Switzerland. And a sample will come here to Nationwide Children's. And in the past, people have learned what are some different prognostic factors, what are some different features of that tumor that will predict how well that child's going to do. And so we test for some of those factors. We put all that together and it's sent back. That's clinical information that's sent back to those patients at their host institution. And they're then rated to be either a low-risk patient, an average-risk patient, or a high-risk patient. And the ones that are high-risk are the ones that are going to be treated the most aggressively. So the aim in cancer therapy now is to try to treat patients based on their risk or based on a specific genetic feature. And the idea is that you want to cure them. We absolutely want to cure them. But we also want to reduce the number of side effects that come from the toxic effects of chemotherapy. And so if you can cure a child with less chemotherapy and you know they're still going to have a 98% chance of never relapsing, then let's give them less chemotherapy and have fewer side effects. Whereas if you have somebody that's very, very high risk, those are the patients that really need those new novel therapies that maybe they do have some side effects, but that's going to be their best chance of survival. And so the more we can tailor their therapy to their individual tumor, the better we're going to be at that balancing act.